بسم الله الرحمن الرحيم وصلى الله على سيدنا محمد وآله الطيبين الطاهرين وأصحابه الغر المنتجبين. أحبتي أرحب بكم أجمل ترحيب، وإن شاء الله هاي جزء من المؤتمر مشاركتنا بهذا البحث. إن شاء الله راح أبلش بالبحث. So this research paper is associated with antibiotic susceptibility of bacterial isolates from chronic suburethric otitis media in Diyala province in Iraq. First, I will give you an overview about what I'm going to present to you. So I will start with the background, then I will move to aims and significance of this study. Then I will explain the study design and results, then end with the conclusion of our study. Regarding the background, otitis media is the most common infection of the tympanic membrane and also middle ear, ranges from acute to chronic otitis media. Chronic suburethric otitis media leading to significant hearing impairment and loss. The mild hearing loss is more common in males than females. Regarding the symptoms and consequences of chronic suburethric otitis media influence the development of speech in children associated with the defects in learning, attention, and psychological disorders. The consequences of chronic suburethric otitis media include tympanic membrane, Ostochian tubes infection, mastoiditis, and extreme cases leading to death. Symptoms of patients with a chronic suburethric otitis media are generally ear pain, fever, redness of the skin above the ear, irritability, and yellow purulent discharge. Regarding bacterial etiology of chronic suburethric otitis media, the pathogenic bacterial etiology of otitis media including Streptococcus pneumoniae, Haemophilus influenzae, Pseudomonas aeruginosa, Staphylococcus aureus, Streptococcus pyogenes, E. coli, Proteus mirabilis, and Moraxella catarrhalis. The abuse of antibiotics for chronic suburethric otitis media has led to rise of multi-drug resistant pathogens, leading to a serious infections and unpreventable complications such as hearing loss and meningitis in severe cases. In regards to aims and significance of our study, this study aims to isolating the prevalent bacteria from patients with a chronic suburethric otitis media in Diyala province in Iraq, and also we characterize their resistance to commonly used antibiotics. This data of this study could help to inform clinical decisions on chronic suburethric otitis media in Iraq. Regarding the study of the design of our study, 46 patients with chronic suburethric otitis media have been included in this study. Ear swab was collected from this patient. Then we inoculated the swabs to selective and enrichment culture media, selective differential and enrichment culture media. Then we use Vitek system 2 compact to confirm the identification of these bacterial species. At the same time, using the same device, Vitek 2 system, we evaluate bacterial sensitivity and susceptibility and their resistance to antibiotics. And also we confirm, as I mentioned, the bacterial isolates. Our results show that the most clinical samples was collected from patients. Their age range from 40 to 50 years old. The most abundant bacterial species isolated from chronic suburethric otitis media patient were Pseudomonas aeruginosa, Staphylococcus aureus, then following by the other types of bacterial species as mentioned in this figure. Regarding bacterial isolates and their association with the clinical symptoms of chronic suburethric otitis media, we found that Pseudomonas aeruginosa was mostly associated with the most of the clinical signs appeared in the patient with the chronic suburethric otitis media, including a previous yellow, greenish pad color, mucopurulent, bloody discharge, hearing impairment, tinnitus, and also vertigo. Regarding to chronic suburethric otitis media, clinical signs percentage. We found that the higher percentage of clinical signs was hearing loss, which was 82.6, then following by a mucopurulent discharge, then a yellow ear discharge. The multi-drug resistant pattern of bacterial isolate of chronic suburethric otitis media patient, the high percentage of resistant was identified in Pseudomonas aeruginosa, which was the most prevalent bacterial species isolated from this infection, as well as we found the higher percentage of antibiotic sensitivity identified in Proteus mirabilis. Regarding conclusions, Pseudomonas aeruginosa and Staphylococcus aureus are the most frequent isolates of chronic suburethric otitis media using media-based isolation method and also phytic system 2 to confirm the identification of this bacterial species. The antibiotic susceptibility testing identified that imipenem, meropenem, amikacin, amoxicillin, ciprofloxacin, levofloxacin are the most effective antibiotic against these pathogens. However, this antibiotic should be used and prescribed in ascending order. These data can assist healthcare providers to formulate a more targeted approach to control chronic suburethric otitis media in Iraq. Thank you so much for your listening, and please let me know if you have any question regarding this presentation and this topic. Thank you so much.